airdrop.
airdrop.
Airdrop đến nhận download. Dạ.
As we go here, you can take the pictures and our photo booth. Furthermore, we do provide free flow popcorn, free flow ice cream, and a bookmark section is
Thanks for coming. Thanks for joining.
Good to see everyone fresh faced on a Saturday morning. I know it's a weekend and all of us want to kind of, take it easy on a weekend, but I really appreciate that each one of you made the time. Don't close that door because then the sound will get blocked because the speakers are out. Sorry. Thank you for making the time, as I said, on a Saturday to join us on a very lively and interesting topic that I think befits the occasion and befits the huge advancement that Beverly Wilshire does itself in the field of plastic surgery. So today's conversation and topic is very close to me as a journalist and writer as well. Is plastic surgery the new self-empowerment? Because all of us are children of social media. We all see, the way we are bombarded with before and after. And we see all our favorite actors and influencers, how they look before and how they look now. And we believe there's a conversation that is happening now, as in do we look at plastic surgery now as a new voice to self-empower yourself? Because there are the tools, there are the means as well, and there's also individuals who are willing and able. So, Dr. Nasir, thank you for making the time. Dr. Wong, thank you for making the time to join us at this session. Is plastic surgery the new self-empowerment? Let's dive straight in. Yeah, great. Good.
Thank you so much. Very good morning to everyone. Thank you for coming. I really appreciate your presence here. And thank you so much for giving me an opportunity to discuss this so-called very exciting topic, I would say. And your first question is really very exciting. Now, you talk about self-empowerment. Plastic surgery actually gives that. Whereas as doctors, we always have to stay in the safe path, not trying to sway into whatever the social media or the society is looking for. At the same time, I must also make sure that the science is there to back up all these whatever issues that we discuss. So as doctors, we are actually scientists. We always based on data and facts. And safety, of course, is the main issue. So when you say about self-empowerment, definitely I agree. I remember when I started my practice about in 1995 when I started my plastic surgery, it's very different. You just tell patients this is what you need and that's about it, and they most likely agree to it and they follow. Yes. But nowadays it's different. It's like the tail is wagging the dog now. So like they are now telling me, doctor, this is what I want and this is what you must do. Yes. So it becomes very difficult. But yes, there are actually studies and research has been done whether all these procedures for enhancement or beautification will really give so-called the result that a patient wants. That means in terms of the self-esteem and empowerment, yes. But I think there was a study in 2021 looking extensively the data for cosmetic surgery, including aesthetic, that shows about 74% satisfaction rate and also 74% so-called confidence and self-esteem and change in life of individuals. So it is actually supported by hard science and data. But at the same time, I'm not here to suggest that that's the only way for as you know, for self-empowerment.
Yes.
There are mixture of factors and issues, and you must remember that plastic surgery literally it's a scalpel with two sides. It cuts both ways, so good and bad, like anything that we do in life. So be very, very cautious. We have to caution you that there are issues trying to give you that so-called whatever enhancement or look that you wish to have. Bearing in mind that these are real surgeries that we do, real so-called medical things, and they all come with recent complications. Of course, they can be managed with good knowledge and skills. So to answer your question, definitely I agree. It gives a lot of sort of self-empowerment with the current situation. But at the same time, not trying to suggest to everyone that you must do plastic surgery for you to be self-empowered.
Yes.
There are many other factors. That's my take into your questions.
Yes. Thank you, Dr. Nasir. Dr. Wong, what would you like to add to it in the field of aesthetics? If you know, it's also a tool of self-empowerment from your perspective.
Definitely, we can look at it. I mean, aesthetics today has become more common, and actually has become the mainstream. It has come to the mainstream. Is that people are looking at aesthetic treatment as some form of like a personal self-care routine.
Self-care routine, yes.
Yeah. And it's just like as common as I remember once when I was reading an article, you know this guy Simon Cowell? He actually gave a birthday present of Botox to his friends.
Okay.
And he was quoting as saying that having a Botox is like brushing your teeth, as common as that. So it's people are beginning to integrate aesthetics into their daily routine, and it's just like as common as they, like some of my clients, they are coming common as frequent as monthly for regular treatments to upkeep themselves, make them look good and feel good, and they just want to feel better. Like each time when they walk on my clinics, they will feel happy about it, about the treatment, about the results. I think that definitely empowered them to do further things in their life.
Okay.
So
So it's definitely
definitely to me is a tool to empower a persons in their life.
All right. Thank you, Dr. Wong. Coming back to Dr. Nasir, we often hear patients say, I want to look like myself but better. How do you balance a patient's natural identity with their desire to create a newer version of themselves?
Thank you. Again, it's a very challenging question because we have our own identity according to our culture and our of course races and everything. We have our own look. For example, we have a Chinese look, or Malay look, or Indian look, or Asian look, or so-called Korean look, or Caucasian look. So there's so many so-called variation. I call as people know, it's called diversity. Nowadays we talk a lot about diversity. By the same time, if you go into aesthetic and plastic surgery, it seems to be like going into one so-called pathway. That means I want to look this way. If you don't look this way, then you're not good. You're not good. So I think that is the culture. Whether good or bad, I'm not going to discuss that. I think I leave it up to the audience and to the society to decide. But as you know, even for let's say for example an Asian, they want to have a nose that look like Caucasian type of nose, where they have more projection and more height in their nose. For example, even though they don't have that so-called total faces to have that kind of nose, but they wish to have that and they tend to like it. So I think that is something that becomes challenging. And also, of course, for those Caucasians, some of them said, "Look, my nose is too projected. I want it to be reduced. To be reduced is the other way around." So sometimes it becomes like, "Oh, this is a bit difficult now because our Asian like your nose, and you tend to go to our type of nose." So I always look into diversity and tell them that in every culture there's a beauty in it. Same like skin color. White skin or black or brown or purple or whatever type of skin. We are no different. You can look pretty in any colors. So that's how I try to put into perspective when I explain things. So your nose actually is not like it's abnormal. It's normal for your type of face or your type of culture that you're living in. But of course, you want a bit of enhancement because of maybe social media pressure, peer pressure. Looking at every day you look at this bombarded by all this advertisement about your nose must look this way, otherwise you are not there. So, and also job, in terms of job application, some of them came to me and said, look, I didn't get a job because I think my nose is not that right. And become like, what is right nose for you to apply that kind of job? so yeah, it's something like that. Come to the extent, and of course issues like family, husband and wife, spouse and everything. They said I fought by my spouse because they claim that I'm not that kind of body that I have last time, and they blame their body parts for it. So yes, I respect all that. I try to put into perspective that even those who have so-called abnormal body shape also can survive in this world, and they survive well, and they prosper actually. So I'm trying to balance things a bit rather than to jump into the bandwagon where, oh yes, we must look this way and that kind of thing. But at the same time nowadays, yes, the pressure is there for us as plastic surgeons, also aesthetic, to actually satisfy their desire. That's what we do anyway. That's what I do anyway. I will try to do that. At the same time, trying to not to as I said, trying to get the middle pass, trying not to drag them or them dragging me into what they want exactly, because we have so many occasions where, for example, they want, let's say, a type of this kind of breast shape that I want the size, and even though after measurement and after telling them the breast augmentation is actually for you to look feminine rather than to show your breast, they said, no doctor, I want that 500cc breast. So when we do that, we're happy for about maybe 3-6 months, and after that they somehow came back, then doctor, you're right, I now cannot find a bra for it. I when I go into the room, all the men are looking at my breast instead of looking at me. So I find that it's too tough for me now. So it's very important that we try to tell them in advance what can and cannot happen. That yes, plastic surgery will definitely improve your self-esteem, your confidence. Yes, you may get that job, you may get that husband or wife that you want, but you must think into, is that what you actually want for you? Are you trying to please someone else? Are you trying to do because of material things? You won't get inner peace. You don't have that mental happiness if you try to please everyone every time.
Yes.
So I think that's my answer to your question.
Wow, that's wonderful to know. That you combine wisdom, and good sense as well. Going to Dr. Wong, I'm sure that you see your fair share of challenges as well, especially now with the younger generations embracing prejuvenation. I feel it's a new terminology out there, but it's very much out there. Being proactive about aging before it begins. Yeah, prejuvenation. Is this a form of empowerment? And do you worry its risks fueling insecurity to worry?
Oh, that's an interesting question. All right, I think like Ethel said correctly, prejuvenation is a quite a new word in the aesthetic industry. I think probably you heard that about 3 or 4 years ago, and you will hear that more often now. But before that, I believe everybody have heard about the word rejuvenation. Rejuvenation is basically you are trying to erase the signs of aging, for example in the skin, like your wrinkles, your sagginess or your loss of volume. But rejuvenation is a proactive kind of treatment where people have treatment before they start aging, or they try even before the aging starts. They are trying to prevent that. It's more like a preventative treatment. And today in my practice, I actually do see more and more younger patients coming to my clinic and start off aesthetic treatment. These are mainly in the early millennials, the late millennials, those in the early 20s, or even today, I do see some teen patients coming to the clinic and started getting advice and wanted to have aesthetic treatment done earlier. I believe this is more of the, like today, there's so much of social influence, social media influence. People are on TikTok, they are on Instagrams, they are on selfie mode all the time, and all these high definition cameras and things, stuff like that. They want to look good and they want to be part of, they want to be seen there and good. And there's a culture of people like, they always have a self-view monitoring nowadays.
Right, the perfect selfie face.
Even like the youngsters, like people who just they are just coming out to the workforce. People have been doing Zoom meeting, so they see themselves clearer and they want to look better. So like rejuvenation serves them a purpose. It's not the treatment. It is a treatment. Basically, quite simply done, things like just a chemical peel or some lasers or maybe some radio frequency that will help to freshen up their skin, and when that will make them feel good and look good, and to them it is a kind of empowerment to them. If they do it for themselves, if it's for self-care, it is great, and they want to control the way they age. They want to control their own appearance, but there's a fine line to that.
Correct.
What happens is sometimes some of these, I've seen some patients have actually gone beyond that. Once they tasted those things, some feel good, look good, they want more. Then they start demanding for more extreme procedures, or then they set some unrealistic expectation of themselves. They want to be perfect all the time in front of cameras. That is the danger there.
Okay.
All right. So.
Yeah, thank you. Thank you. Dr. Nasir, let's come back to you. Do you think plastic surgery can be understood as a positive form of self-empowerment, helping women and men feel more confident in their own skin? And from your experience, can you share some pointers or examples of how you've seen this transformation impact patients' lives?
Well, I think, I think I've answered part of it.
Yeah.
Part of the questions earlier. Maybe to elaborate a bit more additional points and some of the experience. Well, the science, the data has shown exactly that definitely gives self-empowerment for you to undergo either plastic surgery or aesthetic treatment. Definitely, it has been proven by science. But if you ask me personally, I have a lot of personal experience of doing all this so-called enhancement. Of course, in the case that I'm going to tell you is not really aesthetic as such, but that particular patient has undergone some aesthetic procedures or injection of fillers to the nose, and that has caused problems to the nose. The nose is damaged because of the filler ulcers and ischemia. And she has a deformed nose, and we cannot correct it anymore with any form of non-surgical methods. So she has to undergo surgery to reconstruct the nose. Of course, I mentioned to you, plastic surgery doesn't mean only cosmetic, but of course, to reconstruct nose in this case is actually cosmetic. So I did about 3 or 4 surgeries on her. When she had that problem, she lost her job, she lost her husband, and the family sort of said, "No, you're not normal anymore." So she became depression and everything. So she had to seek for treatment, but she still had that little strength to come to me and said, "Look, Dr. Nasir, can you help me? It's not, I don't want to look like a super person, a supermodel or beautiful. I just want to have a nose that I can carry on with my life, to give me that self-confidence for me to carry on with whatever I want to do." So after doing the surgery, and there you go, she actually progressed very well. She became one of the CEO of a company, and she's very happy and came to me and said, "Doctor, thank you so much." I said, "Oh, I'll just do your nose, that's it, the rest is yours, your effort." But she said with that particular thing that was sort of disturbing her mind and her mentally and also of course physically, that has sort of stopped her progress. and after that she sort of progressed sort of like very well.
Okay.
And again she started a new family and everything. So I think definitely enhancement of some of the body features definitely change life, definitely give that some empowerment. And yes, I think that's whether it's going to be like they must come for plastic surgery every day or every week or regularly. I think again I still use the principles of being very careful, try to balance between telling you that yes I can improve you, but I cannot guarantee that by your body look like this you'll be okay. If your body look like this you're not okay. I cannot guarantee that, because the society will assess that you yourself have to portray yourself more than your physical look. If you are, your behavior is good, the way you treat people is good. I think you look very beautiful if you can do that. And no sort of a nice nose or nice dress can fight that.
Yes.
With this kind of thing. So yes, self-empowerment because of enhancement of body features, I agree, and supported by data from science. By same time we're still human, and as human we actually discuss a lot of things, and also have views of our own views of what is beautiful, what is not beautiful, what is pretty, what is not pretty. So I think I still look into diversity to manage this kind of situation.
I love the fact that you're saying that beauty actually is from within first.
Oh yes.
Yeah, thank you. Thank you for that, right? It's beautiful to know that from such a seasoned plastic surgeon saying that. Awesome. Reinstates my faith back. All right, Dr. Wong, before we wrap up, can you share some breakthroughs in your field that excite you the most? And what you feel can transform how we think about identity, aging, and empowerment in the next decade.
Oh, that's a mouthful of questions. Anyway, I'll try. Let's go with the breakthrough first.
Right.
I've been in the aesthetic industry for the last almost 2 decades, and I see lots of innovations or technologies that are happening in my field. And there's a lot of new lasers machines, new kind of injectables. But for me, the most significant is the biostimulatory injectables, which I'm using a lot, as 70% of the works are dealing with injectables. And today we actually moved away from those temporary quick fix solutions. People more tend to have treatments that can give you natural results, long-term natural results. And this group of injectables, biostimulatory injectables, actually serve this purpose. And today there's a change of trends where people are moving away from fillers injections to this kind of injection, biostimulatory. There are lots of it. Nowadays, every 3 or 4 months, there are new launches, there are new innovations that's coming in. And as of the last 2 years, things that we haven't heard before, things like exosomes or like even like the new type of PRN, all sort of polymers that can stimulate our body to produce collagen. They are coming in a wave, and people love it. People don't want to be seen like you have done something, and these are biostimulatory injectables produce slow, natural results because it allows our body to regenerates and build collagen on its own. And this is what people are looking for at the moment.
Yes, okay, thank you. Dr. Nasir, would you like to share breakthroughs that you are also seeing and can predict?
Oh yes. I think most of it are still in infancy. As you know, 3D printing is one of the innovation now. It's not only in medicine, also in plastic surgery, where we can actually print your face, and the AI, whatever supercomputer will calculate the volume and everything, dimensions, and can tell exactly this is the shape of your face that will enhance your features. So and they can produce that implants or that particular prosthesis. I think that's one of the advances now. Robotic surgery. I think maybe in 10 years time you won't be seeing Dr. Nasir here. You'll be seeing a robot sitting here and talking to you and advising you. You human are not good. Telling you that. So be prepared for that. Robotics. They're already now robotic surgery in facelift. They've started the study already in the US. And there's also remote robotics where I can be sitting here and do surgery in let's say, for example, in Australia and that kind of situation. And recently, I think in the news you saw it's about 5,000 kilometers they do a remote sort of surgery, robotic surgery. So I think that's one possibility. Is it robotic surgery better than human? Well, it's been proven that they are more accurate and less in terms of risk. So that has been proven. And then of course the robotics, AI robotics. AI robotics mean no more Dr. Nasir. No more. It's all like what you're talking to your phones now when they want some advice. It's actually not human. They're all AI. Yes. They tell you, look, you must do this for you to be good. If you want to be happy, you do this. All AI. It's not human. There's no human there. So similarly, so there'll be whoever sitting here and be telling you all those. So I think AI robotics means you don't even need doctors to be there. Doctors will be there just in case the patient wants to sue you, they can sue you. They cannot sue the robots. So you're there just to take the fall. And the air robotics is something that is in the process. It's still very in infancy. The other things that I think will be coming soon. I think you mentioned a few. But tissue engineering, that means, you lose your ear, we can take tissue from you and put it in the mouse and grow a new ear and put it back to you. So I think that is something that will happen. You lose your finger, we grow your finger again. This is tissue engineering. It has started, but still in the infancy. So maybe one day you can choose, I want this nose, that nose, and the supercomputer AI, everything can calculate everything and say, we can do that nose for you with 3D printing, and there's your nose there, and are you happy? Then we can put it on you. So it's something that will definitely happen. Even like, this is science fiction. It's actually not science fiction anymore. Right. So be prepared. Yeah. Be prepared. As I mentioned to you, there's no more Dr. Wong that's sitting here. It'll be the robots and the AI doing all the talk and the work.
Wow, that sounds completely so much in the future. Also very scary.
Oh yeah, it's
when
scary,
you talk about remote surgery.
Yep.
Yeah, I think for single women like us, could we also design our own ideal man? Thank you, Dr. Nasir. Thank you, Dr. Wong. Yeah, it's an interesting conversation, and I love your insights. You made it so humane and human for us. And of course, Dr. Wong, very excited to know what all is happening in aesthetics. And I really thank you for your time, for kind of sharing with us as well. And we have, I think, a few questions, Q&A from the audience that we've received. I think highlighted. Joe, you have a question? The highlighter, Joe, is here. He has a question which says, how do you see the future of aesthetic medicine evolving in Southeast Asia? I think that's for Dr. Wong. Yeah, just go back. Yes.
I believe that, as you can see, even in Southeast Asia, I would say in Malaysia, Thailand, Singapore, Indonesia, Cambodia, Vietnam, this is one of the hot places for aesthetics, all right, and it has been growing very fast. Even like in our country, you can see like the aesthetic centers or clinics that has been mushrooming all over the place, especially over the last 5 to 10 years. I think they have quadrupled, tripled, or many times. The time when I started, there was only about, in fact, like in Malaysia, there are only about 30, 40 aesthetic doctors. That was about 15, 18 years ago. Today, there are about 700, 800 LCP certified doctors. So I find that it is becoming more accessible, and then furthermore, there are more technologies to offer safer treatments to the patients, and less downtime, less pain, and aesthetics treatment has become more affordable. And to me, it is going to be, it is like I said, it has become a mainstream already. It's so accessible, anybody can just walk into any of the aesthetic clinic in their neighborhood. They don't have to drive very far to get such treatments. And I believe Southeast Asia is the place to grow, and I see that a lot of countries also trying to come into Malaysia to build their business, to partner with Malaysians and stuff like that.
Yeah.
So I see the potential is there, and I believe that in the next decade, it will grow even further.
Correct. Yeah. Malaysia is already ranked as #1 in medical tourism as well. Great. Do you have any more questions from the audience you would like to ask Dr. Nasir or Dr. Wong? Do you have questions?
Yeah, thank you. I've been hearing a lot about from liposuction to more easier choice, which is called laser lipolysis. And this is fairly new. I don't know. I mean, it seems like it, but I want to understand how effective it is. The biggest claim is that it's non-invasive and as effective as lipo, but I want to understand a little more about it.
All right. Thank you so much for your questions. Very good questions. Just on the outset, is actually it's not a new technology. It's been around for many years. I was doing the laser lipolysis since even in 2012 we started that. I started it in fact years before that in 2009 using the laser lipolysis machine. Liposuction means to remove fat. There are so many ways, non-surgical also. I think Dr. Wong is doing other things like freezing and everything, but as a surgeon I do removal. So the usual technique that we use is the tungsten technique, where we infuse all the fluids and we do the power assisted liposuction. But what is the laser and what is the ultrasonic one? The other is the ultrasonic called VASER. So these are high definition liposuction. So I'm not sure whether you've heard about people want six packs and to curve their body and everything. So they are good for that. But actually, it's not really a six pack. It's a false six pack. They have these clumps of fat on top of the muscle. You must have muscle first to develop that. So yes, it is less invasive in a way that because the laser is breaking down the fat as compared to the conventional one where it's mechanical. So there'll be more bleeding, more pain, and more bruises and more risk of infection because of the tissue damage. Whereas laser is more controlled. VASER, the ultrasonic one, is also the same. So yes, it is less invasive, still invasive, but a bit less. And patient recover faster with less swelling and bruises. So that's the difference between the conventional liposuction using the mechanical breakdown of fat as compared to using laser or ultrasonic, high intensity ultrasound to dissolve fat.
But the outcome is same, right? The fat is still
yes and no. As I mentioned, it's high definition liposuction. If you want certain curvature, especially for those already quite thin, those are actually, they are not like big, high BMI individual. They're not obese. So they have certain deposit of fat in certain areas, and when they wear certain clothing or things, I got one small lump here. This is disturbing my life. So can you please get rid of it? So that's good with the high definition liposuction. They target that, and because with the conventional, it's difficult to target certain areas without causing problems, especially in thin individuals. You may damage muscle, you may damage deep tissues and everything. So with the laser, it's much safer. We can target that particular order with the VASER ultrasonic. So that is the advantage. So it's a targeted, more precise liposuction technique.
But the result, the fat is the same as
the result. The fat will still be removed. In fact, for those who are huge, then the conventional liposuction is much so-called effective because they use high volume removal as compared to the laser or the VASER. So yes, the result, it depends on what you want to achieve. So if you want that, some people only have one small, here a bit here, a bit there. That's where the high definition liposuction value comes, or even your full sculpting. Technique, the non-surgical one. Yes.
Thank you. Yeah, thank you. Any more questions? Yeah, sure.
Okay, thanks.
Yes.
Yes, thank you for the panel. One question for Dr. For those of with medical conditions, like for example hypertension or in anticoagulants medications, are they eligible for plastic surgery? Thank you.
Okay, very good questions. That's why I said very good. I like this kind of question where medical,
Yes.
it's pure medical thing rather than talking about self-empowerment and everything. No, very good. Yeah, because even patients who are severely diabetic and they have high blood pressure and they still want to look good, which is valid. Yes, you want to look good, but your health sometimes doesn't permit it. So to answer your question, actually there's specific criteria. I presented this in the meeting last year about how to choose patient. What is the safe criteria for individual to undergo plastic surgery or even cosmetic procedure? So there's some, they call it body mass index factor, and then the numbers of comorbidity, like you're saying, the diabetes or other things, and also your age, and other issues. Maybe you have other chronic illness. So from there's a score that we do. I don't want to go into details. So from that score, then we put you into the risk category. It's a bit scientific here, I'm so sorry, but this is important. Your question is very important. So because we don't want to risk you just because you want to have that nice thigh, we cannot risk that. Okay. So if you have high blood pressure, if you have control, your blood pressure is controlled. Yes, you can take medication, no problem. You still can proceed. So again, there are other criteria you still have to follow, including smoking. If you smoke, we don't do you because your healing will be rapid. If you drink too much, your liver function is gone. So you cannot metabolize the drugs that we're going to give you. So high risk for you, bleeding risk and everything. So there are criteria, specific criteria. So to answer your question straight, I cannot say yes or no. So we have to go into the criteria, go to the scoring and do the risk assessment, and then only we'll tell you and discuss. As you know, nowadays patients like to be in control of their health and also even aesthetic. So they will also be involved in the decision making. So we tell them, yes, your risk is this. If you undergo it, it's still acceptable according to the worldwide sort of acceptable risk. But you have to decide whether you want to undergo that risk for you to maybe enhance your features. We maybe give you a bit more self-empowerment and the possibility of you become sick and have a complication like prolonged infection and even deformity after that. So I think that is a very good question, and that's how that's my answer to your questions.
And the second question is, for Beverly, what's the ratio that Beverly has done medical procedure to cosmetic procedure?
Okay, I think the CEO have this data, but by just handpicked data, we are focused here more on cosmetic aesthetic. But yes, we still do so-called reconstructive, which is considered like medical. So as you know, the line now is very gray. It's changing. Previously, you're talking about when I first started, cosmetic surgery is like, oh, this is non-medical. This is like, this is what you're doing here is like sensei or hormone treatment. For nothing. For example, when liposuction first started by the French surgeon, that was years ago. When the French started it, not even started by the US doctors or UK, it's by a French surgeon. When they first started it, all the surgeons around the world actually said, "What nonsense you're doing?" Yeah. And now it's the biggest industry worldwide. Yeah. So I think that is something that we must say that even aesthetic cosmetic procedure now has been accepted well in the medical community, and is part and parcel of treatment. Because if you don't like certain things about your body, it affects your mind. Mental problems is a big problem. So you gotta say, oh, it's all in your mind, it's all in your mind. What are you talking about? It's actually, your head is actually the biggest thing that is important for you to face the world. So I think it's important to look into the whole picture, and we shouldn't have any so-called division now that cosmetic surgery or aesthetic procedure is non-medical. So, but yes, if you are the purist you must say that, oh, this is non-medical. This is more like body enhancement, which is non-medical. Whereas things like we do cleft surgery, congenital malformation, we do burns reconstruction surgery here, we do breast reconstruction surgery after cancer surgery. So we do those so-called medical things also here. But in terms of percentage, I would say maybe about 5%. I'm not sure you have that 5 to 10%.
Thank you.
Thank you, Thomas. Do we have any more questions? Yes? Okay, I think the session has been so informative. All your answers.